you've experimented quite a bit with different tools and methods and channels of that kind of communication to the non-medical community. What have you learned that you're like bringing with you now into your Academy Health gig? Welcome to Health Hats, the podcast.
I'd say a couple of things. One is that you need to do a lot of things. I think too many people think science communication is all about finding that perfect soundbite, that tweet or that TikTok that's suddenly going to change the world. And that is not how it works. Good science communication is retail and it is detailed and it requires repetition over and over again. And it requires the building of trust so that people understand where you're coming from and why you're saying what you're saying, and an explanation of how. And it has to be two-way so that people have the opportunity to ask questions and have them answered and feel heard. And too much is just directional. It's just, let me broadcast towards you. It also requires a bunch of different media. The same people who might read a column in the New York Times are not the same people that might read my blog, are not the same people that would listen to our podcast, are not the same people who might watch our YouTube videos. Often the content is pretty similar, but the means by which we give it, how much time it takes, which of your senses you're using differ. And it's important to meet people where they live and where they are getting their information, and not believe that there's just one solution that works for everybody. It's also important, again, I think, to ask questions and listen. We regularly survey our community on their professional needs and personal needs and how they communicate and how we might better reach them. And we work really hard in trying to train our members to do this better. Our flagship online course, Communicating for Impact, is designed to address this need and covers the foundational aspects of strategic communication, knowing your audience, crafting effective messages, choosing the right channels to deliver those messages, much of what I was just talking about. We also just piloted recently another online course specifically to address misinformation and how researchers can use communication strategies to build trust with key audiences. Because it is not enough just to wait till something bad happens and then post a counter. It doesn't work. It also doesn't work to sometimes bring attention. But if you can build that kind of key trust over time, one, you can not rebut, but pre-butt messages by getting people to think better about how they take in information, to question its truthfulness, and how much they should trust where they're hearing it, where they're hearing and what they're hearing. But again, that it takes time and effort. It's not, I don't want to say that it's easy. I've spent 15, 16 years with this being one of my true passions. And as you practice it, as you do more, you get better at it. But no one is born with those skills. And I think that's one of the things people also mistake, is they think you're born a good writer, or you're born able to do video, or you're born able to do podcast. No, it takes time. It takes practice, just like anything else.
I host, write, and produce Health Hats, the podcast, with assistance from Kayla Nelson and Leon and Oscar Van Leeuwen. Music from Joey Van Leeuwen. I play Barry sax on some episodes alone or with the Lechuga Fresca Latin Band. I'm grateful to you who have the critical roles as listeners, readers, and watchers. Subscribe and contribute. If you like it, share it. See you around the block.